if there's just one thing I want people to know about the SI joint or the sacroiliac joint, it's that the lumbar spine can refer symptoms to where the SI joint is. Which means if a patient points to just his right SI joint or just his left SI joint, and maybe the pain is radiating a bit into the buttocks or even the thigh, that doesn't necessarily mean the problem is in the SI joint. In most cases, I find if a patient presents with symptoms in those specific areas only, the problem is the lumbar spine. And in very rare cases, the problem is actually at the SI joint, which is a much more robust joint and much less vulnerable to mechanical tweaks or other pathology. A few rules to think about with the SIJ is that pain typically does not go down past the knee, or signs and symptoms are not typically below the knee. Symptoms and signs also do not, or symptoms do not cross the midline. So if you have a right SIJ problem, symptoms are going to be on the right. And thirdly, symptoms are not going to be higher above L5. They're not going to go upwards towards the head. But if someone points to, it's just right here, and they point to where the SI joint is, for me, I must rule out that it's the lumbar spine, because of the prevalence. That's why it's so important for clinicians to understand prevalence. If someone comes to you with symptoms that could be something that's very common, or from something that could be very uncommon, we have to consider the common source first, just because of prevalence. Now, for me, what that means is I will do mechanical testing or repeated movement testing, usually as part of my spine evaluation. And in most cases, like I said, that will reveal that the problem is lumbar in origin. And in most of those cases, we can resolve it by moving the lumbar spine in a direction or two repeatedly. But if we do move the lumbar spine in lots of different directions, we challenge it and we find that nothing is changing in that pain distribution that matches an SIJ problem, notably, specifically unilateral in the SI joint, possibly radiating down, then I will do my SI joint tests. I will do about 5 of them, a cluster, and look for a positive sign in 3 at least of those tests out of the 5. Importantly, I'm not doing those tests before I rule out the lumbar spine, because those tests can be positive for the SI joint if the problem is in the lumbar spine. So we need to know the sequence of events that gives us the best answers to our testing. So I'm not going to be doing those tests unless I've ruled out the lumbar spine. Then they hold validity for the SI joint. And then I will do those 5 tests and figure out what's going on with the SI joint. It may be mechanical, it may be inflammatory, it may be structural. We have to get to that decision down the road. But please remember that just because you're pointing to that one side, even if the parameters fit for SI joint only, meaning the patient's not saying sometimes my back aches or sometimes my left shin gets numb and tingling even though it's my right SI joint. Even if they don't meet those criteria, which most people do, if you really pry about where signs and symptoms are, it will not meet the specific required criteria for an SIJ problem. Even if they meet those, it's likely lumbar. So we are ruling out the lumbar spine with our verbal history, with our baseline taking, and with our testing, usually repeated movement testing, but also other lumbar tests, possibly even escalating tests to an image in the rare instances where it's needed. But we're using that testing to rule out the lumbar spine because of the high prevalence of referred symptoms to the SIJ area, not to mention the buttocks and the thigh. But this is not kind of my individual idea. You need to know what dermatomes are. You need to know what scleroderms are. Those are the areas mapped onto the body where we know certain structures, certain parts of the body can refer symptoms. And for the lumbar spine, it's very clear that it can refer symptoms a little bit out to the side and down where that SI joint is.